Right, it's 6 o'clock now, so if you don't mind, we'll wait a couple of minutes. We're expecting more people to join. So we'll start in 2 minutes. Apologies about that. Right, so let's get started. Hello and welcome everyone. My name is Mohammad Yaqub. I'm an assistant professor in computer vision at Mohammed bin Zayed University of Artificial Intelligence, and I'm a research fellow at the Nuffield Department of Clinical Neurosciences at the University of Oxford. Today I'm going to talk to you about how does AI help fight the COVID-19 pandemic. Before I do that, if you have any question, please put your question on the Q&A option. If you probably can see that in Zoom, and I'll try to answer as many questions as possible at the end of the my presentation. Right, so a little bit about me. I have graduated from Oxford University in the field of biomedical engineering. My research work is mainly in AI in medical image analysis. I have spent more than 17 years doing research and teaching at higher education institutes. The last 12 of these were at the University of Oxford. I've published more than 30 peer-reviewed articles and have successfully granted 2 patents, and I also had 2 research licenses, and these are some sort of these are research that I have done at the university that has been acquired and licensed by a company, which is a great thing because you want to see what you do helps the community. I am a reviewer for several high-tier journals and conferences such as Mutate, Medical Image Analysis, British Medical Journal, Open, and many others. Plus the academic side of me, I have an industrial side. I've spent more than 6 years in industry and mainly trying to develop AI-based solutions to clinical problems, to healthcare problems. I have led the research and development team in a company called Intelligent Ultrasound, which is a system. In fact, I have a video here to show you. It's called ScanNav. It's an AI-based solution which is able to analyze images in real time for anomaly scans for pregnant ladies. So during pregnancy at 20 weeks, the sonographer or the clinician will be trying to look at the several parts of the fetal body and trying to understand if there are abnormalities and if the fetus is growing correctly. And this AI-based solution is, while the sonographer is trying to scan, it checks in real time all these images and auto capture the clinically adherent frames that are within the guidelines, the international guidelines, and it assists the quality of the images against these guidelines. For instance, shortly in this video, you will see that the sonographer is trying to acquire a different part of the body. For instance, here, I think it's trying to acquire the 4-chamber view of the heart, and this is a very fast beating heart. And the system automatically tries to find the best of these and automatically capture that. You probably have seen that a green box has been turned, a box has been turned green, and the system automatically have done that. This has been done during my research at Oxford, and then later on I joined the company to work as a vice president of engineering to further develop that to industrial standards. And thankfully it has been licensed by the largest ultrasound manufacturer in the world, and it will be in the market by the end of this year. So this is probably the most important thing I've done in my life, because with regard of my research, because I can see the value to the community. And just to give you a number, there's approximately 140,000 birth a day. So in reality, or in theory, this sort of AI-based solution could help 140,000 pregnant lady every day. Even if it helps 10% of these, I think that will have a massive impact in the whole world. Right, enough of me. Let's talk about the topic. Before I start to talk about how could AI help improve or help fight the pandemic, let me talk about the pandemic first, and then talk about AI, just to give you a background on that. Then I'll move forward to my topic. Pandemics. So this isn't the COVID-19 isn't the first pandemic that hit the humanity. I'm here just listing 3 well-known pandemics which had a massive impact on humanity. The Black Death, for instance, happened in the 14th century. It was estimated 75,000, between 75,000 to 200 million people died from that. Okay, so that's a chart, sorry. And then much later than that, in the 1918, we had the influenza, which is known for what we call it the Spanish flu. And this is a devastating pandemic. It hits approximately, it infected approximately 500 million people. And believe it or not, this is almost a third of the number of people in the world at that time. So 1 out of 3 people has been infected. And it's a deadly disease because the infection rate, the mortality rate or death rate, it was 10%. So approximately 50 million people died. And then much later than that, we had the HIV in the 80s, and still until now. And in total, WHO approximated the number of deaths to be 36 million. I'm not trying to scare you here, but there are many other pandemics that happened with a smaller number of deaths. So in the 21st century, we had first the SARS-CoV in the 2002, and then in 2009, 10, we had the swine flu, and in 2014 we have the Ebola epidemic. So there were few other pandemics or epidemics that hit the humanity with different impact on the humanity. I just want to put you in context of the COVID-19. So let's talk about COVID-19, if the slide goes. So COVID-19 comes from what we call coronavirus disease 2019. In other words, other name for it is SARS-CoV-2. In fact, it's sort of like from the same family of SARS-CoV, which emerged in 2002. It's not a new virus as a coronavirus, but this specific one is a novel virus. But coronavirus is just a generic name for a family of viruses. It mainly affect the lungs, so that's why it is it make some patients have respiratory illness. And up to date, we had more than 18 million confirmed infection. Okay, so it's not just, so we might have much more than that, but the confirmed one that's the estimation for it. And approximately there's 700,000 deaths to date. Again, these numbers are all approximation, and I think unfortunately the number is more than that because there are cases that some countries couldn't count. So that's COVID-19. So just to give you a little bit more background before I dig deep into my presentation, let's talk about AI. Artificial intelligence, so what is it? You probably have heard of it because you're coming to this talk. So AI, I like to describe it as a set of tools and concepts which allow computer to learn, to do some tasks. And sometimes people just gets confused when we say artificial intelligence or machine learning. And I want to describe the difference, in my opinion, the difference between machine learning and AI is machine learning is a subset of the artificial intelligence. So machine learning in general, I like to describe it as a set of algorithms which aim to learn from experience. Just to make you understand that further, in simple terms, imagine you are walking down the street and you're with your little kid and you see a cat, and then you say to your son or daughter, "Oh, look, here's a cat." This is a very simple sentence you say to your son or daughter, but you taught your child from experience, from an example. And that's what machine learning is mostly about. It is, we try to teach computer from showing examples or giving an experience to the computer, and the computer is trying to understand the sort of the patterns and the features within from this experience. And in the heart of machine learning, we have what many people have heard of, probably. If you haven't, then I'm sure you will hear about it very soon. You heard from me now, but you'll hear a lot outside. It's deep learning. It's a buzzword now, so let me just try to describe it in very simple terms. So deep learning is a subset of machine learning, a set of algorithm which is based on what we call artificial neural network. It's not something new, although it only gained interest in the past 10 years, but it has been in the books and papers for a while. So what is it? Deep learning is a sort of like some sort of algorithms which aim to mimic how human brain works. So in our brain, we have neurons and connection, and we have some signals sent from one place to another. And through a deep learning or artificial neural network, we aim to mimic that in a computer. We were only able to do it recently in the past sort of 10 years, because mainly we had a massive improvement in hardware or compute power or memory. And plus, there was a massive improvement in the algorithmic improvement in the past 10 years. So just to describe it in simple terms, imagine we are trying to teach a computer how to distinguish pictures of cats from pictures of dogs. And what we do in deep learning is to provide examples of that. And what the computer is trying to do is, as you see in the network in the middle, is trying to come up with some sort of features or sort of what we call kernels that are able to figure out the characteristics or the features within the cats alone and the dogs alone. And then according to that, it tries to figure out how to distinguish between cats and dogs. And it has multi-layers, because the way we teach these is through a multi-scale approach, where we aim to learn information at a low-level features, what we call low-level features. And then while we go further in the network, we try to learn a much more global features. There are much more into that. So if you're interested, you probably can. We find lots of tutorials about deep learning, but this is a very important topic in artificial intelligence. Right, so let me now focus on AI and COVID-19. So I split my topic or my presentation into 3 sections. I split it into where did AI help before, during, and after the pandemic. In the first section, I'm going to talk about pre-COVID-19. How could AI algorithms predict new pandemic? Just let me go back a few months right at the beginning. We know that in the 31st of December 2019, China announced a new virus. A few days later, after that, WHO issued their first disease outbreak news. And a couple of weeks after that, WHO published the guidance. And probably mid-March, WHO announced this new pandemic. So if you look at this timeline, probably it's about 3 weeks, although it doesn't look like a very long period of time. But in terms of pandemics, 1 day makes a big difference. In fact, 1 hour could make a big difference. But the reason for that is infection could spread much faster at the beginning because you know nothing about the disease. You don't know who is infected. You don't know the causes, the infection, the speed of infection, and so on. And to convince you, at the current world traveling, what we see now in the world, people could travel from one place to another very quickly. So it doesn't take you long to travel from Dubai to Abu Dhabi, for instance, or even from San Francisco to London. So 1 hour or a few hours, it could make a big difference. If you can get into the disease right at the beginning, you could actually, you'll have a much bigger chance to stop it. And the reason I put this timeline is just I want to tell you this. On the 30th of December, multiple companies, including Blue Dot, which is a Canadian company, and Health Map, it's a Boston-based institute or company, they actually flagged unusual increase in pneumonia cases in Wuhan. And all what they rely on is they have their own AI algorithms, AI, artificial intelligence algorithms, that are running in the background, which what it does, it reads and mine and try to understand if there is any unusual behavior to predict if there's any new unusual behavior to predict any unusual cases. And for instance, Health Map in this figure I'm showing, what they do, they parse and read and mine as many news and social media and possibly articles. And from that, their AI algorithm is trying to understand if there's some unusual behavior in any country in the world. And they managed to figure out that there is unusual behavior a day before China announced the new virus. And although this is there's a lot of data that an AI algorithm needs to learn from, just reading all the news in the world, it's a lot of data. But the problem with it, it's very noisy data. Not only that, you don't know which part of the data is meaningful, which one is not, which one is related to pandemics, which one isn't. And you need the AI algorithm to be robust. And imagine that we have an AI algorithm not only reading or trying to mine data coming from news, but also from a more robust source of data, such as hospitalization in different hospitals, flights details, because you want to also predict the infection. So if you know that there's unusual cases happened in say London today, then you want to know who has traveled from London to where, and you want to track these people. I'm going to talk about tracking later on, but this is very interesting things to know about, that AI could be influential, especially for future pandemics, because in my opinion, we were not very prepared for this one, but this is something we will learn from. Now, let me talk about the AI battle during the pandemic, and this is probably the longest part of my talk. Where and how AI helped in these domains. There are different domains that AI did help during the pandemic. I won't be able to cover all of them, but I picked interesting ones that I'm going to talk about. So I'll be talking about the healthcare domain, where AI helped in detection, diagnosis, treatment, workflow improvement, and vaccine development. Also, I'll be talking about how could AI help in research, researching COVID-19, and this is a very interesting topic. I'll discuss it shortly. Tracking infection is massively important because you want to limit the infection and stop it from its root. And if you have a way to robustly find infected regions, even in especially local regions, then that would be very beneficial. Decision making is very important. You want to have a way to robustly make decisions, which will be very helpful for communities. And also managing our life, because obviously you can tell that every part of our life has been affected. So you want a way to make our life easier during situations such as lockdown. All right, so let's talk about healthcare. So first, let's talk about detection. One of the main problems we had at the beginning of the pandemic is we didn't have, many countries didn't have enough PCR tests to detect, to test people. So here's an example of a well-known work by researcher in King's College London and plus other institutes who have managed to create an AI algorithm which is able to predict COVID-19 infection from symptoms. So you fill your symptoms and then plus some metadata such as the demographic or and other simple information you fill, and then they managed to predict. They created an AI system that has managed to predict COVID-19 infection with a relatively high accuracy. And remember, PCR is not 100%. It's probably there are different studies, but in general, it's about 70 to 80% sensitive, the sensitivity. So this is a very well-known publication in the Nature Medicine by this group, which has published their work, and I think all their work is free, open for people to look at, and the app as well. But that's one way to detect. Another way to detect infection is using imaging and medical imaging. And there are many different research. The one thing that was very interesting at the beginning of the pandemic is that many different people stopped doing what they're doing in the research domain and started to work on COVID-19, which is really great because you want to figure out solutions to the current problem because it's affecting every single one of us. Using imaging, there are different research groups who worked on X-ray imaging to detect COVID-19 patients, and the figure on the left, the two pictures of the X-ray, is from work which was published in TMI, IEEE TMI, which has managed to detect COVID-19 and quantify it from the lungs of X-ray images. Another work has been done on CT, and there are many other works which have been done on CT scans. And this is an example that has been published recently, which they managed to detect and predict COVID-19 from CT imaging. And not only that, also quantify the infected region, because the more the infection, the worse the worse the situation for the patient. So you want to know how bad the situation in each patient, not just if that patient is COVID-19 positive or not. Another interesting work has been done recently on ultrasound. Ultrasound is not really in clinical practice on pneumonia and detecting pneumonia in the lungs. It's not heavily used, but recently has been used a lot because it's really portable. You can take it to the patient. It's easy, it's cheap, it's safe, and many other advantages. But it's very complex to assess. And for instance, in this video of an ultrasound scan, this is actually, believe it or not, this is part of the lung, where if you see the vertical lines, these are some sort of indication that this lung has some sort of infection in it. And because in reality, if it's a normal patient, you should not see vertical lines. You're more likely to see horizontal lines using ultrasound of the lungs. So ultrasound is able also to tell you about consolidation and if there is any fusion and pleural fusion. So these are different methods that has been used to detect, but not only detect, also diagnose the COVID-19 patients. Other places where AI has helped a lot is treatment. So when you want to treat this disease, you want either to discover a new drug, or you want to repurpose an existing drug to treat this disease. So AI has been influential here because if drug discovery isn't a straightforward thing, and you probably have heard that when a new drug comes to the market, when a new medicine comes to the market, it will be very expensive. And the reason for that, pharmaceutical companies spend years to do lots and lots of experiment to reach to the right combination of molecules to make a drug, and then they will start doing human trials after that, and it takes years, traditionally up to probably 3 to 5 years. But AI-based solution, now we see now some pharmaceutical companies which uses AI to generate and discover new combination of molecules which can help treat the different diseases. And in reality, you could end up generating or discover a new drug in months or sometimes days, because you can, if you have the hardware, enough hardware capacity plus enough details or information or data to pass to your AI model, then you will be able to create you can simulate a model which will be able to test your many different combination of molecules to discover a new drug. Also, drug repurposing, I talked about that. So this is about, you don't create a new drug, you already have some drugs for other disease and you want to use some of them, you want to test if some of them is able to treat another disease. So we heard about hydroxychloroquine and different drugs that has been tried, and AI has been proven important in this domain, because there are different studies that showed that when they used AI, they can test hypotheses and they can simulate things much quicker. An example, there were 4 different studies that tested multiple drugs, and they 4 found a specific drug that is very helpful. That happened in, I think, early July, that drug could treat COVID-19. Again, a very important thing to notice here is that now AI can make us develop things much more quicker in a robust way. So then another major domain to think about is the vaccine development. And we have in Oxford here, well, we have the one of the best facilities for vaccine development, and we're now in Oxford University. They are in stage 3 trials for a new vaccine, which proven to be sort of working, but again, this needs to be tested very intensively on a large number of people. And the whole idea is, traditionally, the way it works, that you have a vaccine, you test it in the lab, then you start testing it in human, and later on. And it takes time. It takes a very long time. And like 10 years back, if researchers wanted to have a vaccine that goes from right at the beginning all the way to the patient on a large scale, this takes years. So now many different companies and research institutes are trying to develop that within months. And an example that where AI is proven important is AI help us predict things. For instance, viruses mutate. So how could we create a vaccine which is able to handle mutation in viruses? The good news is coronavirus doesn't mutate as bad as other viruses so far, as far as we know so far. And an example of mutation and interesting work has been done by NextTrain. If you go to this website, I think I should have it here. So NextTrain is what they've done is they track the infection right at the beginning. So if you see here, this is December, and these are different countries, different continents. And what they've done is try to follow up on the disease in different countries and also figure out where things happened. For instance, here you can see that what type of mutation happened at this instant. And this is belong to probably Europe, Italy. So this sort of data is really influential and important because it helps us develop AI-based solutions which can predict things. Going back to vaccine, very interesting work has been done in Australia in a research lab, is that people use deep learning. Specifically, they used what we call generative adversarial network in deep learning to generate a combination of vaccine and test these these molecules against their target. The whole idea relies on having a computer producing different and many different compounds, and a discriminator is trying to ensure that what gets generated from the AI algorithm is as realistic as possible. So you use a computer model to model this, and this has happened in multiple places, and there especially by a research group in Australia. So this is healthcare. So let me talk about other domains where AI helped significantly and still helping. AI helped a lot in research. Imagine this. Imagine we want to figure out a very smart person, probably not me, who is very, very smart, and we want that person to go and read and understand all books and research articles about coronavirus from 20, 30 years. And we want that person to tell us give us solutions for after reading and understanding all these resources. It's going to be very challenging. I don't think we're going to find that person. But what we could find is a computer program. So we can use what we call, part of AI is natural language processing, which is a field of science which is able to read and parse text and data, textual data and numbers, and try to try to understand, not only understand, but also connect the puzzle of reading many different books and articles. And a great initiative happened right at the beginning of the pandemic, and it's now in Chicago. It's called COVID-19. It's a challenge, actually. It's an open research data set challenge. It contains more than 195 scholarly articles. And what is asked here, there are 17 tasks. What is asked is to create some sort of solution, probably AI-based, to mine all these articles and try to answer some interesting questions. For instance, one of the major tasks is the incubation of the disease, the infection, the way the infection works, and many other major tasks is there. So if you're interested, you can Google that. It's on kaggle.com, and it's a very interesting research project. But the initiative itself is really great, because you don't want just one research group to do the work. You want to make these things public, and then ask different people all over the world to contribute. Another great initiative is by NIH. It's called iSearch COVID-19 Portfolio. And again, this is another one which has more than 28,000 articles. So the whole point is to try to come up with an AI solution which is able to read all these and try to understand and connect the puzzles and answer many important questions which we don't know how to answer it yet. AI has been also proven to be important for tracking infection. There are many different institutes and companies who've developed AI-based solution that tracks infection, and they feed their AI algorithms data from, for example, hospital admission, self-reporting by patient, credit card transaction, which is really interesting. I think it happened in South Korea, where you could use credit card transaction to predict where could be the next infection, because if you have access to credit card details of people where they've used their credit cards, then you could say, if a person is infected today, you can go back in time and see where this person has used his or her credit card. And then if that person has used it in a restaurant 2 days ago, then who were in the restaurant, who paid with their credit cards in the restaurant 2 days ago. And then you can track these people and maybe provide advice to do some test or maybe do some quarantine and so on. AI is really important here, because we as a human, we can't go and just look at this data and just do it in a piece of paper or even a simple way of tracking. We need a much more complex way of tracking, where we feed a large amount of data, because we don't know where exactly the most important features within the data, and the artificial intelligence algorithm are able to detect that and figure out these features. So another domain which is really influential is policy making. We need to be able, if you're in government, you want to make sure that the decision that you want to make will be helpful, will be solving problems rather than making problems. I'm sure some countries ended up making some decisions which were wrong, so they have to backtrack and change the decisions. Can we use some sort of an advice from AI? And that's something that different companies are working on now, where they're trying to create AI solutions to be able to provide advice to government bodies when they are to make some decision. And the way this works by creating a simulated action. So you provide the AI algorithm with some actions that you're planning to do, and then the AI algorithm is able to predict or give you the consequences of that robustly. And this is, to be honest, is still a domain that people are still working on, and it's still an open research problem. Right, so this is during the pandemic. It probably started to talk about also the recovery phase, but now let me focus more about my third part of the topic, is how could AI help us recover? How could we do, how could we solve all these consequences that happened from after this pandemic. I'm not saying it's the end of the pandemic. I hope so. We're still in it, and many countries are right at the beginning. Other countries are hopefully right at the end. And it's important to understand that the road to recovery is going to be very long. But with AI, I think we will shorten that road. We'll make it quicker, easier, and more robust. And there are different ways, different problems that we have to fix. I'm just listing 4 here, but there are many other things that we need to take care of. Let's just discuss these in some details. So in healthcare, how could we recover? I don't want you to think of healthcare recovery just that we need to recover patients who have been infected of COVID-19. They want to recover from COVID-19. We know that COVID-19 mainly affects the lungs, but what we don't know many other, there are many other questions we don't know the answer to. For instance, now we don't know exactly how does the virus mutate. Initial studies suggest that it doesn't mutate a lot. In other words, it doesn't change its infection rate. It doesn't change its severity. It seems to be not impacted by temperature as much as other viruses. But anyway, we need to understand that. So understanding that helps us create solutions. And AI could, as I said previously, is very important to simulate how and try to understand how this virus could mutate. And we should also not forget about other viruses, because it's not the only virus we have. Unfortunately, there are other viruses. And in a couple of months' time, we'll have the seasonal flus, and we need to start thinking about that as well. And I talked about vaccine and how vaccine isn't something that will happen in a day. So we will have vaccine hopefully soon. But the question is, will it work? Does it work for a longer time, or will it work for a short period of time? Do you need to have multiple vaccinations per person, and so on? And probably the most important part, in my opinion, for the recovery in healthcare is not about the COVID-19 infection itself. It's about COVID-19 patient with comorbidities. We know that if a patient already have some sort of a disease, like such as heart, kidney, liver, diabetes, high BMI patient, these are people who are on a higher risk to be, or when they get infected with COVID-19, they will be on a higher risk, and they're more likely to be hospitalized, and they're more likely to go to ICU. And unfortunately, some of these they're more likely to die compared to people who don't have other diseases. So what we don't know now, that what's the long-term effect of COVID-19 on these patients. What we know from very preliminary work by different groups, especially from China, that people who have heart, liver, or kidney disease are more likely, some of them are more likely to get long-term effect. So what we want to establish now is how could we help these people? How could we ensure that these people will not have healthcare consequences after a year or 2 or 4? So a person who have a liver disease, who is in general is likely to die within, say, 10 years, will that person be in a higher risk to die within 3 or 4 years because of the COVID-19 infection, because there was some effect on the lungs or sorry, on the liver? So this is, in my opinion, a very important thing that we need to understand and establish. And let me announce this today. So we at Mohammed bin Zayed University of Artificial Intelligence will be launching a mobile app very soon, hopefully by end of this month. And the aim of this app is to gather detailed information from UAE residents and people in the UAE about the COVID-19. And hopefully this will allow us follow up and do some vital research to help many of these people. So keep your eye on the news, and it will be great if you can help us use this app as soon as it gets published. It will be running on Android and iPhone. So keep your eye on the news. So to continue, another major aspect of that has been hit hard is our economy. Every economy in the world has been hit hard. Can we use AI to help in this domain to recover our economies? AI has been actually, not just now, not because of the pandemic, has been used significantly in the last few years in economical modeling. And there are many different companies working on this domain. In Oxford, for instance, we have the Oxford Man Institute. And this is a large institute just working on the use of machine learning in prediction and estimation of things related to the financial applications and economy. And AI economist here, for instance, is a system created by Salesforce and Harvard University, is also able to provide government bodies or people who are using it a good way to model the economy if some decisions have to be made. So this will allow policymakers to simulate in some environments by providing some proposals and actions, and then hopefully the AI algorithm will be able to robustly provide you with a model or the prediction of what will be the consequences of specific action that will happen by the government. Also, supply chain has been hit hard. So for instance, I'm talking to you from Oxford, by the way, today, but hopefully we'll be soon relocating to the UAE. In the United Kingdom, we had a shortage of flour and yeast right at the beginning of the pandemic because many people rushed to buy this. In different countries, they have shortage of many other things. Can we provide ways to these industries to predict what could happen to the economy if a specific action happened? If we can predict that there will be shortage of some medicine or some sort of food product, then these companies could provide a much better way to mitigate this shortage and possibly speed up processes during their work. Last one is the remote working. Most of us are working remotely now, but AI could be actually very helpful in improving this, because I think many of us struggled at the beginning, but there are some AI solutions where there's no time to talk about them, which now are helping in improving the way that remote working happens. Another major problem that we had is education. Let's just talk about that. Let's just talk about student in school education. Also, universities is probably another big problem. But I, similar to many of you, had issue that when at the beginning of the pandemic, my kids has to stay at home to do homeschooling. If there were some solutions to help me and my wife solving this problem, and not the problem, but make the education at home much easier, or also making the education at school also easier, then that would be great. And there are many companies working on this domain. There are AI-enabled LMS, learning management system now, which has automatic grading within it. And also in education, virtual reality, especially after when we have the 5G, the virtual reality, the usage of virtual reality will be massive in education, because you can have ways of providing information in a much more convincing method than just having video calls or audio calls. Another major thing that many companies have been working for many years, and it's not just related to education, it's related to many other domains, is natural language processing, which is related to text translation and text summarization. I mean, imagine this. Imagine you have some sort of help from an AI agent who you could pass to it a whole book and ask this agent to create a summary of the whole book. Or maybe you can create you can ask the AI agent to create personalized summaries, because you want that AI agent to focus on a specific topic within the book. That could improve education. Maybe it will make us a little bit more lazy, but it will have a massive impact on education. You don't need to learn French to read books in French. Then you could have a very robust AI-based text translation. We're not there yet, but there's lots of work happening as we speak. So these are the different stages of the pandemic. Before I finish up, I want to focus on and talk a little bit about some risks and concerns of AI, which I myself share some of these, but also I'm sure many of you think about these as well. One of the major things that we keep talking about when we talk about artificial intelligence and big data is data privacy. And you want to ensure that your data is private. You want to ensure that The first thing you want to do is to provide data to help the humanity, but at the same time have your own privacy. There's quite a few bottlenecks for us to or that we need to go through, or many hurdles that we need to jump on to really have an agreement all over the world. How could we actually provide proper data privacy, at the same time benefit from the data that we have? What you don't want to do is also keep the data saved in some archive system and nobody use it, and then we can't create solutions to problems. AI is data hungry, so AI relies on data for it to work very well. So we need to feed the data, but we also need to be wary about how we protect data, people's data. Regulation is another major problem and has lots of hurdles that regulators have to overcome. And I'm talking from experience here, working in industry. AI-based solution system, it's still at the early stages by many regulators, including FDA, about these systems. So finding a solution and deploy it into the market and for people to use, there isn't a very straightforward path for regulation. Still something that gets reviewed from time to time. And more importantly, now we have what we call online learning or online AI, which is an AI, think of an AI agent that you deploy, but also with time, it learns more and more. It becomes better and better, probably, over time. So because this AI agent changes behavior, the regulation for such regulation for that agent is very, very challenging. And I don't think even we have a very common consensus on that. Security is a massive problem. Is the problem everywhere? It's not just in AI, because what you want to do is to make sure that what you develop is highly secure. You don't want anyone to hack an autonomous driving car while people in it driving and make some major problems. And that's another thing that we need to ensure, that security is of top standards on any application, to be honest, not just AI. Accountability is another issue that we need to think about. If things go wrong, and things will go wrong, because there isn't, even AI algorithm, they're robust, they're strong, but they're not 100%, they're not bulletproof. So if things go wrong, who's accountable? Is it the developer? Is it the company who's done that? Is it the regulator? Is it the user? Is it the, I don't know, the government who allowed the people to use it? Who's accountable for that? Is it the researcher who developed the algorithm? This is something I think more work has to be done here. And robustness, AI solutions are showing very high accuracy and they're really robust. And I can tell you from experience in healthcare, we've managed to create, and many other researchers managed to create AI solutions, which is as good as a very experienced clinician. But the problem is, when an AI makes a mistake, people will actually look at it in a different way. For instance, let me give you an example. An autonomous driving car, if an autonomous driving car makes an accident, there will be lots of media coverage about it. There will be lots of things, and we heard that when it happened in Arizona. But if we think about it, how many accidents happen every day? Normal accident. There are thousands of accidents happening as we speak, unfortunately. But we need to think that when we develop AI solution, we need it to be as robust as possible. Before I finish, so I can answer some questions, I want to leave you with this message. So when will be the next pandemic? I'm not saying there will be, but it's likely to happen at some point. Maybe we don't know when, maybe next year, after 2 years, after 100 years, we don't know. That's the problem, we don't know. And that's what made us, in my opinion, not prepared, well prepared for the COVID-19. So in my opinion, we need to prepare better. And to do that, one of the main things we need to do is to do more research. And with that, I would like to finish my talk, and thank you everyone for attending today. If you have any question, please put it in the Q&A. Shortly, I'll start to look at these questions and answer as many as I can. I'm sure there will be lots of questions, but if I can't answer your question, please please send your question to my email address or to the emails that you see on the screen now. Thank you very much. Right, let me look at that. Cool. Okay, so if you have time, please fill the poll that has been sent by the conference, the talk meeting, and during this time, I'll be looking onto some of these questions. So there's a question about in which way can AI help in developing a vaccine for a virus? So AI could help us speed up the process and of the development of a vaccine. The problem is that in traditional ways, you need to try, a researcher tries things. It's a trial and error. So you try a combination of molecules and then try them in the lab to how they, if you infect them in a sample, will they generate the right antibodies to fight a specific virus? This sort of process, that's the traditional one, is time consuming. And vaccine used to take a very long time to develop. AI could be is actually influential here because it can simulate things. It can tell you that what sort of combination you can use to create a vaccine for a specific virus. Okay, so that's another question. What if we come across a case with a limited data? If I understand this question correctly, how can we solve some problems if we have limited data? The problem is, as I said, AI solutions requires lots of data. And for it to work very well, you need to feed this data plus the annotation, or what we call the ground truth. The more you feed it, the better it gets, as long as this data is as clean as possible. But in many scenarios, we don't have enough data to solve a specific problem. So how could we do that? This is actually a very widely open research problem. Many researchers are working on developing AI-based solutions to learn from data. And I'll give you an example. I said at the beginning of my presentation that deep learning, for instance, is mimicking how we think. But if it's mimicking how we think, if I show you a couple of pictures of a cat, then I showed you a third picture of a cat, a different cat, you will likely to say that this third picture is actually a cat. But you only saw two examples to be able to learn what a cat looks like, to know to answer to answer the question about the third picture. But AI doesn't, unfortunately, until now, doesn't work like that. For it to work well, you need many different pictures of cats to be robustly answering the cat question. So it's unfortunately, there isn't easy solutions so far. There are some publications to work, AI algorithm to work with limited data, but I don't think we're there yet to be able to work on very challenging tasks, especially in COVID data. But it's wide open domain. Okay, so how long would you believe before AI is able to model and synthesize vaccine in quick turnaround? It's currently been used. I think previously it used to be years, but now we're talking about months. And my belief, just talking to colleagues in Oxford here, that in future, it's very hard to tell when, we will have, because we will have the computing power and data, we'll be able to simulate vaccines in a matter of days, really. But the problem is, when it is a new virus, there are so many variables you don't know about. So you want to gather as much data as possible right at the beginning of the pandemic to be able to simulate, to figure out the right vaccine. And to me, looking at multiple institutes, for instance, in Oxford, we are now at stage 3 clinical trials, and I know that in Abu Dhabi they already have that. In the UK, in China, in many different countries, they're already started human trials, and that's a great thing, because believe me, like if we're like 10 years back, we would have not been doing that as quick as we were doing it now. A very long question. Okay. Does AI in fighting pandemics require data to be shared in the medical and technology community? How is it possible when companies are competing for the same market share? How can we incentivize them to cooperate and not compete. So this is a very important, this is an interesting question. In my opinion, I worked many years in research, and I also worked for more than 6 years in industry, and I know the way it works. I think the way we should be trying to do it is, if it's a pandemic, it means that we need to do things quickly. We need to do things not only quickly, but also robustly. We don't need to rush things. So I think we should be open in providing data to the research to be used by medical and technological community. We should be aware of the consequences of sharing this with companies. Obviously, if we want solutions, we should end up giving companies the trust on using this data, and I know that there will be many companies who want to compete for developing, for instance, a vaccine. At the end of the day, this is something that we have to be, in my opinion, to be widely open to share, as long as there are the right regulation in place. Okay. If you could give AI a letter grade A to F for its use during the pandemic, what would it be? Or, okay, so I assume A, with A means highest grade and F is a low, we failed. I would say it varies depending on where we used it. And I think in vaccine development, I would go for a B, just because we're still not there yet to have a fully AI-based solution, but we've done great things in a very short period of time. In policy making, I think we're almost F, probably in D, because we haven't used AI properly in many different countries. Some countries did, but many countries didn't, and that's why we see there's a big discrepancy between countries. We see the infection curve. I'm sure you saw that in the news. So, for instance, in the UK, we had a very bad way of the infections increased so badly, and now it's dropping, but it's dropping really slowly. What you want is, if you look at the South Korea, for instance, and many other countries, where the curve is like really sort of like a straight line. And to be honest, it's very hard to know. We will be able to grade how well did we do probably in a couple of years' time, because some consequences we haven't seen yet. Jafar, I'm sorry, it's a very long question. I'm happy for you if you just copy it and send it to me by email. I'll skip that. You have another one. The false positive ratio was relatively high, but definitely the technique is probably this continuation of your question. Some advanced cases of COVID-19 affected neural cell and brain. That is correct. Actually, in some news, some researchers are now trying to understand the effect of COVID-19 on the brain, and there are some initial studies suggesting that there will be some impact on the brain for some patient. We don't know how much, but what we know that the impact is actually more likely to happen in the lung, heart, kidney, and liver. Two questions here. I'll answer one of them. Let's take the shorter one. How do you prevent bias when adopting AI in policy making? It's very challenging. I don't think you can do that easily, because I think the main thing for me, which I think will be very important, is to educate community, educate people about AI and how to use it. 20 years ago, we didn't have smartphones, but now we're using smartphones. Every one of us almost is using smartphone. We adapted to that, so we learned the technology. I think AI has to be something like that. I think our kids have to learn that for them to be able to use it in future. And if you actually educate people properly, then you're hopefully you're likely to reduce bias when people are using AI solutions when they're making important decisions. I think this is 59. I'll try to answer one more question. These are long ones. Sorry, if you please drop me an email. I'll try to answer this question later on. Do you think AI will replace physicians? Last question. Okay, here's my thought about that. I don't think, I work in healthcare. I've been asked these questions many times. I don't think AI will replace physicians. What I think that physicians who are using artificial intelligence solutions will replace physicians who are not using artificial intelligence solutions in future. So if you are a medical healthcare professional, keep your eye on healthcare solutions, AI-based healthcare solutions, because they will be very helpful. I would like to thank you, everyone. It's 4 o'clock here in the UK. It's 7 p.m. I think all of you want to probably go. So I'll stop talking now, and I really would like to thank you all. Thanks a lot. Bye-bye.